Okay, so how would a medical provider or organization know if they should hire a medical coder? At what point in their practice and at what point in the organization does it become a necessity, and is it only specialty specific? How would they
Because I was going to say, in order to generate a claim, you have to have a code. So you're going to need a coder, whether it be a biller and a coder in one, or I hear a lot of physicians, their spouses or their office manager who does it all. Either way it goes, they're going to need somebody to code. But I think when you said certified, but the rule of thumb now is if you're not certified, you're not a medical coder.
And so let's talk about that, the certification part. Why is it important for the medical coder to be certified? Because I hear this a lot where someone like you mentioned, someone has these dual functions in a practice or an organization, and they are double as office manager, practice manager, and the coder, and maybe the billing manager, and all these different hats that they're wearing, but they've never been certified as a coder, yet they're entrusted with this very vital part of the medical, the billing creation process, and an extension almost of the provider themselves as a medical coder. Why is a certification important?
The goal of certification is to prove your knowledge. In other words, just because you don't have certification, I have met some dynamite coders. I mean, I think I got my first training from a lady that had done coding for years and wasn't even certified. She was an RN by training who had come off the floor as hands-on patient care into a medical record department and had done coding for so many years. She could teach me some things that I couldn't find in a book. It's just from experience. So I'm not knocking coders that have experience and have been coding for years. I just wish those coders would go back and get certification to back their experience. Because now with industry saying you have to be certified to be a coder, it's kind of hard, because a lot of times those that have been doing it for years have been working for the same organization for years. They know that position, they know that position's work, and they can code it like the back of their hands. But put them in another industry or another setting, and they kind of lost.
Right.
So with certification, you're able to prove yourself, because certification doesn't focus in on just one specialty. My students used to always tell me, CodeMaster Coach, coding is hard. And I'll say, is it going to be like that in the real world? And my answer is, in the real world, you tend to go into specialty coding. So right now in a CPT book, you might just be doing OBGYN coding. But in class, I have to teach you path lab, E&M, anesthesia. I have to go through every one of those areas. You have to learn all of those areas for certification.
Right.
But when you get out there, you're only going to focus on one specialty. So it's up to you to stay current and stay studied up. Even though you're only working for your OBGYN, you're not using your path and lab or your other areas of surgery codes, radiation or radiology. Even though you're not using that section of your CPT book, stay current. You don't know if you're going to leave that office, what else you might do.
Right, you want to grow into something else.
Right, but yeah, certification is the big thing now coming out. You need to be certified.
Very good. So tell me a little bit about what you said the industry standard is, or if the industry requirement is for certification. Why do you think they are requiring the certification, and why does that benefit the practice organization?
A prime example is, like I told you, the lady that I trained under when I first got into healthcare or health information management. Because she knew the shortcuts as far as that facility, she could teach them to me. But if I were to put her in another setting, she couldn't. With certification, I always have students saying, which certification should I go for? Which is right? Start with entry, and you'll figure out which one is the next one that you should go for, because there are multiple ones out there.
Right.
But, and you asked me, you asked me to focus in on something on that question.
So why is it that the industry is requiring certification? What is it that might benefit the organization or the provider themselves to have them be certified? Is it there for a layer of protection, or what's the purpose behind the industry requiring certification now?
And the weird thing is, they don't recommend which certifications. What I'm finding is that, for example, someone like me coming in, already certified, working, if I go to hire somebody, I know which certification they should have. But a lot of physicians will just, or even practices will just say, just be certified. They don't know whether it's a CPC, CCA, CCS, RHIT, or RHIA. Just be certified, which just means just have some kind of training or certification under your belt that proves you're competent. Because on certification, anything is your competence. You get someone that's been in it for years that's not certified, they know their facility, but they're not current on the new guidelines, and they know just enough to get by. So I think that's where certification comes in, why it's so vital. As far as credentialing, I guess the legal standpoint for organizations, I haven't heard yet of any laws that state that your coder has to be certified. But I do know that industry wants certified coders. Because I always tell my coders, when you interview for a job, be prepared to be tested. Take your own code books, because it's hard to go onto their software and their system and take a test at your interview.
Right.
Take a test with you bring your own resources, bring your own code books, your medical dictionary or whatever, and be prepared for a test. Even though you've got your certification, when you go and interview, hopefully they'll have at least 10 questions for you to code that pertain to what their specialty is, so that you can, in addition to certification, prove yourself.
That's great advice, right? Because knowing that you have a certification, but perhaps they want to see your knowledge put to the test with their scenarios. So they, rearrange some patient information and give you a scenario of exactly what their organization or practice deals with on a daily basis. They want to know that you'll be successful with the organization, because coding, it's an investment for any organization or practice and a coder. And so it would be important to know that they're not going to have to reveal or uncover, the inadequacies weeks and months down the line.
Especially because the organization is ultimately going to be responsible that hired the coder. It's going to be ultimately responsible.
That's a really good point, actually. Making sure that there's a proper process in place to evaluate your coder before you put them in place. And, I say this too, just on the topic of the wife topic, or the person who's worked with them forever. Like, does the provider organization do enough kind of reevaluating their knowledge and growth in their own coding? Because perhaps they've done this for years, but now this is a new day, a new decade, perhaps, they haven't done any training or any sort of, or not plugged into an organization like an AAPC or an HEMA to keep themselves up to date on what needs to be changed, not just for reimbursement purposes, but also just for the due diligence of communicating accurately what's going on with the patient. I love talking about, and we'll do a separate video on this topic, because I'm sure you probably have a similar perspective. But a lot of providers, they go the quick route. They want to send on the claim, or the organization wants to send on the claim just enough to get paid. But the claim itself, it's telling a story. That's the purpose of the coding, is the coder should be able to place that information on the claim so that it really tells the story to the insurance company. And we spent so many years of not having the technology at the insurance companies for it to understand that story well. So I think a lot of people started relying on, well, if they need more information, they'll just request medical notes. Well, that's not happening anymore. In this day and age, the organization or the insurance company wants the provider or the practice and organization to send the narrative in the claim, because their software is now intelligent enough to be able to decipher, okay, this is the frequency of, this is the second or the recurrence of this particular condition, and here's what the provider did, and here's what they are, recommending for the patient in the future. There's all this information that can be communicated on a claim form now, and I think it's beautiful, as long as you as an organization or provider are taking that into consideration to really make sure that everyone on your team is staying aware of how to use the codes to your advantage. Because we tell a lot of our providers that, if you use your claim properly and you code it properly, you can really prevent the possibility of an insurance carrier coming back and requesting medical notes, or the possibility of then going back and getting audited by that organization in the future. Because if they start to question, this automatic coding that you or your staff is doing, and they're just picking out these kind of like what they think to be the best reimbursing codes for services that they're providing, without really trying to tell that particular patient's story, their unique story, then they see it. The insurance company software, they see all of these trends. They have all of this great analytical software, and they say, 75% of that organization's codes are the same for all these patients, yet one is 25 and the other one is 85. They're looking at the variance in the ages of, and the one is a female and one's a male. That's so odd that we would see all this exact same consistency in the coding. So they're paying attention, and so it's really important that you start to, I said we were going to talk about this later, but I love this topic because it's so many people miss the mark on it, and especially the way that technology has moved us so far forward. You have to make sure your people are trained. You have to make sure that they're staying up to date, and at the very least, like plugged into the coding organization, maybe that they have their certification, because there's all kinds of resources and groups out there that they can be a part of, even if they aren't necessarily, kind of on their own earnest without getting just their necessary CEUs. If they're not just going out to get and they're not doing anything above that, they can at least be plugged into when someone announces, oh, did you notice this change is occurring or that change is occurring? They can really be a part of the conversation that people are having about those changes.
Right.
Yeah.
Right. And believe me, the continuing education that's required for each of our certifications in coding is no jokes. The CPC is 40 hours every 2 years.
That's great.
So it makes you stay.
Right.
And if you hold multiple, 40 hours for my CPC, my CCS is 30 more hours, my RHITA, and so it's adding up. I spend a lot of time in continuing education.
Yes, and you know what? It makes it easy. When it's required, it takes the thought out of your mind, because it's almost like, I say this like for the state inspections on a car. Like if it's required for you to get your car registration done or whatever, then it means you're going to be looking at what's happening with your car on a regular basis without you even thinking about it, right? It's the same concept. It's like if they're making that a requirement, for safety or whatever the inspection is, then you are now you're abiding by the rules. And you're going to just keep yourself educated because it's a requirement, to have those CEUs without even thinking that, oh wow, I'm plugged in. I know what I'm talking about. Right.
Yeah.
Great.